Clorazepic acid is a benzodiazepine used to treat anxiety, partial seizures, and alcohol withdrawal. In this video, let's found. What is clorazepate? What is clorazepate used for? Contraindication. What are the side effects of taking clorazepate? How does clorazepate work? How to use clorazepate? What is clorazepate? Clorazepate, sold under the brand name Tranxene among others, is a benzodiazepine medication. It possesses anxiolytic, anticonvulsant, sedative, hypnotic, and skeletal muscle relaxant properties. It was patented in 1965 and approved for medical use in 1967. What is clorazepate used for? Clorazepate is indicated for the management of anxiety disorders or the short-term relief of the symptoms of anxiety. It is also used as adjunctive therapy in the management of partial seizures and for the symptomatic relief of acute alcohol withdrawal. Contraindication. Contraindications to clorazepate include known hypersensitivity to benzodiazepines and acute pulmonary insufficiency. Side effects. Adverse effects of clorazepate include tolerance, dependence, withdrawal reactions, cognitive impairment, confusion, anterograde amnesia, falls in the elderly, ataxia, hangover effects, and drowsiness. It is unclear whether cognitive deficits resulting from the long-term use of benzodiazepines return to normal or persist indefinitely after withdrawal from benzodiazepines. Pharmacodynamic. Pharmacologically, clorazepate has the characteristics of benzodiazepines. Studies in healthy men have shown that clorazepate has depressant effects on the central nervous system. Since orally administered clorazepate dipotassium is rapidly decarboxylated to form nordiazepam, there is essentially no circulating parent drug. The use of benzodiazepines, including clorazepate, exposes users to abuse, misuse, and addiction risks, which can lead to overdose and death. Patients treated with clorazepate may also develop suicidal behavior and ideation, and the use of clorazepate may cause interference with psychomotor performance. The concomitant use of clorazepate with opioids may result in profound sedation, respiratory depression, coma, and death. Mechanism of action. Clorazepate is a benzodiazepine with depressant effects on the central nervous system. Benzodiazepines are able to enhance the binding of gamma-aminobutyric acid, GABA, to the GABA type A, GABA receptor by binding to a region in the extracellular domain found at the interface between the alpha symbol, and gamma subunits of the GABA receptor. The interaction of GABA and the GABA receptor promotes channel opening, leading to an increased chloride influx. Consequently, the use of benzodiazepines, such as clorazepate, leads to neuronal hyperpolarization. Half-life. The serum half-life of clorazepate is approximately 2 days. Nordiazepam, the primary metabolite, quickly appears in the blood and is eliminated from the plasma with an apparent half-life of about 40 to 50 hours. Dose. Anxiety. 30 mg per day PO in divided doses. Adjust dose gradually within range of 15 to 60 mg/day. When administered as single daily HS dose, initial dosage is 15 mg. After initial dose, responsive patient may require subsequent dosage adjustment. Seizure. 7.5 mg POQ8HR, increase by less than 7.5 mg per week, 90 mg per day maximum. Acute alcohol withdrawal. Day 1, initial 30 mg PO once, then 60 mg in divided doses, no more than 90 mg. Day 2, 45 to 90 mg PO in divided doses. Day 3, 22.5 to 45 mg PO in divided doses. Day 4, 15 to 30 mg PO in divided dose. Day 5 onwards, 7.5 to 15 mg PO in divided doses. Discontinue when stable. Safety advice. Advice and warnings for the use of clorazepate during pregnancy. FDA Pregnancy Category N, not classified. That's all the information about clorazepate we collected. Thanks for listening. Do not forget to like, share, and and subscribe for the HeInfo channel if you like this video to update more health information.